chieftaincy, under it, but because these obas play very, very integral role when it comes to local government administration. And critics have actually said that the disconnect between local government administrators and these obas have actually been the reason why we have issues, problems at the local government level. What are you doing really to ensure that these people are there serving that advisory role for the local government administrators?
Thanks so much. If the local government administration started with the obas, started from them. So it's not, and we know that they are the closest to the people. If you are chairman of local government, you have a balance and oba under your jurisdiction. That means we don't tap from them. The system we want to use now should be bottom-up approach. You need to get source information from them. We need to know their needs. Governance is not about you giving them what you think they need. Governance, I can come to GDP and think, okay, GDP need this transmitter or this, but your need might be another thing entirely. So we need to ask people, what are your needs? And I want to say this. Local government cannot survive or perform efficiently without the traditional councils. Even a lot of crises, they help us to solve. Look at Ake, at times we say Ejokus Ake. The meaning is, they have some people that adjudicate. And when there is an issue, you refer to them. And they give, and those things they do take a lot of burden off the government. And we are now saying that for local government, no matter what they are doing at state level, if it's not taken down to the grassroots, if it's not felt by people, what people want is dividend of democracy at their doorstep. And the only thing you can do that is to go back to the local government. And we also need to allow the local government to carry out that commissioner role. People are saying a lot of things about local government autonomous. That autonomous local government has been there. Nobody has taken it.
I was actually almost going there, because we cannot be talking about local government administration and then this issue of autonomy will not come into place.
I think
people have said that is actually the bane.
It's very, very germane.
But is it going to be business as usual?
Now I'm saying that I am saying business as usual. Even during our father, Volusegun Oshoba, during Daniel, autonomy has been there. Even last administration, I won't say autonomy wasn't there. But the only issue is about the funding, because it's a tier of government and you should allow them to function. But you can assist them, because there is even a law that said that about 10% of the general state must go to the local government. And that is to show the importance. And I was discussing with somebody else. I told the person that it's not a misnomer or mistake that there is no ministry of state at the federal level. At state, we have ministry of local government. It's only strengthening the importance of this local government. And that if you don't give them enough money to function, how will they perform? Because all these are function of money. But the only thing that the ministry is supposed to do is supervisory role. Let's ensure they do the things the way it's ought to be. Their money, even the NFIU saying the money has been going to the local government directly.
Now.
Yes. So that is the only thing they need. But the only thing we will not allow, that is still a legal thing, even at our state, is that we can still play some supervisory role. And I visited the Oba last week. Tomorrow, I'm having a meeting with all the local government chairmen to say, okay, how do we move? Where are we moving from here? Because that is only area that we can help this administration. If we are at that top level and we decided not to go down below the line, to go back to the grassroots, we won't get this thing right. And I want to assure everybody that this, because we will give them what they will think, the way we think we should go. We'll put them on their toes. Anything in the next 3 months, thank God they are coming in January. In the next 3 months, they will be 100 days in office. Then we want to adjust them. We want to see what can they offer, what can they do. If they're having problems, that's what the purpose of that meeting tomorrow. If you think finance is your problem or your IGR has been taken, you are not making enough money, let's do. Let's see what we can do to straighten things. So we will be able to have a robust and well-tailored local government that can be able to give us dividend of democracy to the doorstep of our people.
Now that you
cannot be
said,
coming to the state.
now that you have you've said it, that the allocation is now going directly to the local government's coffers, we are going to be right to ask for more from our local government officials.
Definitely yes, but but we will still do something. We still, because JAC meeting is statutory. We should be having JAC meeting, just like we are going for FAC at the state level. We should be having JAC meeting. And the purpose of this is that if you look at some local governments at times, what they get may not even be enough for them to pay their bills. I'll give an example. If everybody want to, most people that want to, in primary school, when they want to retire, they come to Urban. They have that serving, and they've served several local government. But when they are retired because of age, whatever, is that they come to Abeokuta South, Ijebu Ode, Ado Ota. That means the burden for payment of pension will be more on those local government. If you are thinking of teachers, the number of teachers Abeokuta is having cannot be compared to what you are having in Remonot, for instance. So there are some first line charges that everybody must come to terms with. For instance, I can say today, for teachers' salary, less all of them know what it is supposed to pay. They will charge it, it will be paid. For pensions, for pension funds, less being paid. Because we don't want to show by probably the government is giving 100 million. You have to pay teacher 150 million. That means the person cannot even pay teacher, talk less of doing some things. And we want to look at all this. How much are you paying to teacher here? What is your allocation? Are you comfortable? If you are not comfortable, what can the state do? I mean, that situation. At that time, if you're able to look at after all these expenses, so you have much to play with. You want to see what you want to do with this much. And it's a public document, something you can be publishing on a monthly basis. So you have opportunity, you have access to it, and they have the freedom of information. But you can ask questions, we will supply information. And people that are not asked, this month, what have you done with it? This month, what have you done with it? So to me, it's opportunity for us to go back to the basis, to go back to a situation whereby local government will be able to provide the needs of our people. Not their want to, because one at times you look at their needs. At times we go and test people, they tell them they need secondary school. Now ask them, how many primary schools do you have in this area? And when they are in primary 6, how many of them stay back in those villages? If they need secondary school, need in the nearby place where people can go, we need to, how do we transport? Today, now we are going towards, we are now in the dry season. How many grading are we going to do? What are we going to do? We, at our retreat, I raised one thing last time, that a lot of people are running away from rural areas. And if you want to, and unfortunately for us, it's as far as education is concerned, we don't have alternative in the rural areas. In the urban area, we have private schools. Nobody will take primary school to the rural area. And yet, people are running away from going there to teach. Who are those that are going to take them? What you can do is this. One, make the life comfortable for them. We are looking for some model village. A village that you can have, let's give them water, give them electricity, it may not be much, but at that side, if you are now working in Oguma village as a model village, you can stay in that model village for 1 week. Be moving from there to wherever you are lecturing, you are teaching rather. And if you are doing that, you can also then introduce rural incentive. If you are in rural area, if you are paying me the same amount you are paying people in the urban area, how do you want me to be moving? I will spend a lot of money on transportation. My car will have problem. So we need to put all this together. It's okay. Local government people in your rural area, how many are they? People that are in the urban, how many are they? What can we do? Those are the things we want to discuss tomorrow. It's going to be a very lengthy meeting, we say, because it's going to be a very serious business. Sure. And I want to assure the government of Ogun State that local government administration is in a good hand, and the result will come sooner than later.
Autonomy of local government, that's one issue that has been bothering my mind for some years. People will say, let the local governments have their autonomy. But what about allowing them abuse the autonomy? Are you going to allow them abuse the
No,
autonomy?
I'm saying that our role is supervisory. And that supervisory will not allow them to mismanage it. But they have the right to their money. The issue is, if governor is helping them, at times, that the allocation of local government might not be enough. But you need to put it in black and white. We need to let people see it, that we are the one assisting the local government. If I are saying, yes, I'm the one paying, helping them pay salary, I'm the one paying. I've asked this question before, that assuming a state cannot pay salary, will federal government take over that responsibility from the state? We know, the only thing the federal government did for us sometimes ago was to give up bailout. So if the local government is having problem, let the base local government out. Cannot say because of that, when we are talking of autonomy, most people are saying it's just financial autonomy. When they have financial autonomy, because they have that right, that role, that responsibility to monitor what they are doing, for us to ensure we keep them on their feet, and that they don't mismanage the resources. Even at state level, at federal level, even at federal House of Rep and Senate, we have committee for state affairs that still check what we are doing at state level. So we must have that is, and this is a ministry. The responsibility is check what they are doing at local government. They don't tamper with local government money. The money belongs to them. But as a father, you can say, okay, my children, you have this, but I want to see how we want to manage it. But not you saying, this is your money, take 1,000 today, go and use to do this. It's not state money. The money belongs to the local government. And we want, and if by law you fail to respect the constitution, both the federal and that of the state, then we need to follow the law.
Are there room for sanctions too? If a local government is, a particular government is going astray and is not really spending its resources judiciously?
Definitely there is. Even though most of those sanctions can come, when they have the legislative arm, it can come. State assembly can recommend, but no governor can just go and sanction without the due process. So if there's due process, you mess up the procedure, the laws are there, clearly written. So, and once you follow all this, there won't be any issue. And I want to assure you, nobody, one of the local government chairman, are not performing. Sincerely, the only thing is to do is to put them on toes and push them. They only need to be pushed. Because you cannot tell me that somebody is local government chairman, the president doesn't know what he or she wants to do. That means, why do you put such person there in the first instance? So that means if you are saying, especially issue of people want to run for election, if people should, that you are worthy enough to be there through election or whatever, and you are there, how can somebody not be saying you don't have the ability? The only thing to do is to guide them. To say, okay, you are not this, no, and I have the authority to monitor all the local government as well. So I can be, it's my duty to be moving from one local government to the other. That one, for instance, after I visit to, I'm going to tell them, in the next 3 months, I want to see what you want to do with your money. If you have financial problem, come to us. I'm going to go on, please, let's bail these people out. The only thing, because if they don't perform, the problems still come to us. Government cannot function, they are non-performance. We affect our own election, whether we like it or not. And if they are performing, that means our election is just.
I was actually going to go to that. The machinery of the political party, ruling party in the state, APC.
Yes.
Is it also oiled and strong enough to determine the right kind of people to run our local governments, you know, in the next 3 years? You know, by the time we have new election in local government.
You see, there is, to me, there's no perfect process. But the only thing we need to be looking at is, let's give them a benchmark, whoever that is there. Okay, I want to say, okay, for instance now, government has decided we want to have 236 primary school renovated. Okay, if I now call the chairman of local government, also choose one thing. Government is choosing primary school. Government is also want to have primary health care in all the, but what can you do that can add value to our people? You see, by way of what they need just to grade the road for them. That's their need. Some is just to give them borrow. How much does it cost to have a borrow? 1.5 million, 2 million at most. If you have 10 wards in local government, that's about 20 million naira. So can somebody be saying you want to deny people water because of just 20 million naira? Those are the things that we need to come to terms. You need to really look at what you want to do. Because any government must know that the failure of local government is the failure of that government. That is it. There's no true way to it. So that is why we need to strengthen our local government. We need to do what is humanly possible to ensure that things are properly done. And in everything you are doing, you all have a name to protect.
Now, with the picture you have painted, particularly the fact that some of these local governments cannot even pay their salaries. Now, it means that a lot of these local governments will have to look inwards and then generate, think of areas, revenue, for their revenue generation.
That is core. Without revenue, you cannot survive. And I've told them, there are some revenues that are jointly earned with the state. So I'm going to have some percentage. And I will work towards that. If you are having a revenue that you jointly owe, then what is due to them should be given to them. You cannot deny them money and expecting them to perform. But the only thing with that, all that is money possible to ensure that if anything that have revenue, but they also need to think outside the box to have revenue. Revenue to get money is not something that is easy. It's easy to spend money, but to bring the money together, it's not as easy. So they need to sit down and think about the boss on how to raise revenue. If they need assistance from the state, they can cry home to me. I've served as secretary of local government before. I understand the way it operates. I know what is there. So that's why I told people that I know that's what handle this local government and chieftaincy. Contact of chieftaincy, I'm not the chief. I don't know how it's being done. But in terms of local government administration and in terms of grassroots mobilization, I know I'm more than qualified to have it. And I know that is the essence of governance. One issue of Oba or Oba, we don't have issue with it. We don't have issue because once the local government is functioning very well, they know the right thing to do with Obas. You need to seek their input. When you are seeking their input regularly, when you are meeting with them regularly, and you're reporting back to us, and we report it back to the governor, and we will be able to do the needful. We'll be able to do what need. And if we need money, primary school is not the function of the state per se. It's that of local government. If government is saying I'm going to renovate 236 primary school, it's doing local government function. Yes, but we know we need, you cannot leave all this to the local government because they don't have the resources. The government is ready to assist. When you have a very good project you want to do that we know it give us mileage, then governor can assist and say, okay, so government is the belly of the state. Yes. Not like state, the federal government be giving bailout to the state. So we need to, but you must come to town, we must know what you want to do with the money. We must know that this thing will be beneficial to us. Once it's beneficial, we don't need to, we can bend down backward for us to achieve it, just for our people. Because the essence of governance is for our people to feel the impact.
Now, Commissioner, some people have also expressed fear about staffing in local government. They believe that it's over bloated, that some local governments don't need the kind of staff that they have. Are you convinced about this, or you are also going to investigate?
Somehow convinced, because I've gone through local government before. But the essence of governance is also to reduce unemployment. It's also our responsibility.
Yes.
Are you with me? And there's no government that's okay. You are having 1,000. You should go home without giving them alternative to go where to go. So it is part of our responsibility. It could be an insensitive on the part of the government. The only thing I think they can do is they can make better use of them. There's no need for you to say you don't have revenue, you have people sitting down in the office. No. There's no way you cannot go farming, employ people, let people supervise it for you to raise money. So to me, if the people will feel that they are blown because of the fact that they are sitting in the office. The local government will be able to think and say, okay, all of you are here, you are making money, you are taking your salary. We must bring income. So I want to reassign responsibility to you. Once you reassign, it can be useful for another thing. But it's not to say that everybody want to do paperwork. Paperwork this time is no longer fashionable now. What's the job of one person? A system can do for about 10, 50 people. But that does not mean you should relieve them of the appointment, because all this still burn time to purchasing power. And the government is the largest employer for now until we are able to get. That is why the government will be saying, oh, whatever, public-private partnership. And local government should look into that too. If I have cassava, I can go to somebody that can go and look at what can you do? Can go and plant, what can you use this cassava to do? What can we do? I can employ, you can use your local government staff, and that can be bringing money. Because without them earning income too, your tax will also reduce. So come back to the same thing. All these taxes we put together, all this is still part of your revenue. So enhance them. If I thought they are not having white-collar job, or they are being paid, make alternative use of them,
their time.
So that can bring
Now,
better things to you.
election is actually regarded as the biggest festival of democracy. Why? Because of the integral part or the integral role it plays as far as democracy is concerned. Once we get it right in the course of election, then the people that emerge from this election would actually be right set of people. Now, of recent, the federal government said the state electoral bodies will not be conducting local government elections, that it will be the responsibility of the Independent National Electoral Commission. What's your thought on this?
I'm 100% in line with that, 100%. Because we don't need to deceive ourselves. Show me a state that the particular party is ruling and has not won local election 100%. Show me one. Sincerely, the truth must be said. The truth must be said. To me, it used to be INEC. In 1999, the first election was conducted by INEC. And then we have PDP, we have PDP, we have the AD, we have. But most times, when it's being conducted by state, what you see is 100%. Maybe out of, maybe 99.9%.
Landslide.
And so there's no way, those to me, it's not helping our democracy in any way. Because we need to go back to people, we need to see for the mandate of people. Because, and it's not because they're manipulated, because people that thought that, it's okay that I want to conduct this election, what? I will not trouble myself. People will not take us serious in the country, and that is why people are running away from state police. So to me, if beginning to, after all, governor is coming on board, try next. Presidency is coming on, and this is chief executive of the local government. Why don't allow them to come on?
Now, if you support this stance of the federal government, let me also take your thought on this. I stumbled on a piece, and then it was Afebe Balola who was talking, and he said the people benefited from the local government the more in the early 70s simply because there was zero party system at that level. And then people were elected, local government administrators were elected based on who they are in that local government setting, and then what the people know they can do.
One of those that don't believe in this zero party system, because our system, I don't think nowadays allow for it. No matter how good you are, you need somebody. You are not yet there. You need somebody to monitor. Our moral level those days cannot compare to nowadays. Even if you are in a polling booth watching, people want to manipulate. If you are now the only person, you don't have somebody, I can say, I want to man this place because of my party. So if it's my name, will I have enough family to man all the polling booth for me? It's not enough. Yes, but if you are good, you still need a platform. And that platform can still help you if the election is free and fair. That's what people are saying. Let's make election free. Let's get mandate from people. When I get a mandate from people, political party will be very careful in choosing the best in that area. So, okay, Brother Labi can make a difference for us. If you're making this, then you know we can. Then we go to Brother approach him to come around that they apply for our party. But if Brother also say, Brother Labi, if Brother now wins, and I go to his office and say, where do I know you? Say me, my father's name that. I mean, so that may be a little bit difficult to.
I want to commission on the final note because we have to end this interview now because of time.
I may have to come back.
Yes. I'm also taking it from where you ended. Is that why you were appointed commissioner for local government and chief justice? Because you said it that any government that fails at grassroots level, it's already a failure. Is that why the governor chose you? That this will not be a failure.
I wouldn't know because the power of anybody is that of the governor. Yes. Tomorrow you can wake up and say, go to Ministry of Special Duty.
Or sports.
Yes, I say go to sport. But the only thing I know is that you will not take the Ministry of Women Affairs. That's the only thing. So the governor has the right. He has to take anybody anywhere. He service to our state. But I know that anywhere I've given the opportunity, I will not fail my people. Not about the governor. Our people. If I'm not failing our people, that means I won't fail the governor. I will not fail our electorate. I will not fail our party. Because we campaign the governor for this thing, we walk around the clock to have it, and people are watching all of us. And we must just get it right. And anywhere, anytime I'm called upon, any ministry, I'm ready to put in my best.
All right, we've got to bring the commissioner back in the days ahead, certainly. When we have to continually monitor him, and at the appropriate time, we have to bring him back. All the same, we have to thank you so much for coming, Commissioner for Development and Chief Justice Affairs in the State, Honorable Maruf. Once more, we say congrats to you for this new office.
Thanks so much.
Okay, we'll take this break. When we return, we shall be talking about Lassa fever. Stay with us. Don't go anywhere.
Plenty package. Why you can't still they manage? Why you the stress? Why you the worry? Are you late? Oh yeah. You got everything you need.
You can choose to manage everything else, but not your data. Get more out of life with the new Airtel data plans. Dial *141# today. Data is life.
Airtel, the smartphone network.
The habit of texting or using phones while working is becoming rampant, and it can be dangerous if you are not careful. You could get hurt, be robbed, or be hit by a moving vehicle. Avoid accidents by being more alert while walking on the road. Wait until you reach your destination before checking your phones. Life is precious. Stay alive and limit the use of phones while walking on the road. This message is from OGTV, the People's Telly.
Tablets, capsules, and injections help treat illnesses and help us stay healthy. However, inappropriate use of such medication can lead to worse conditions or even death. Consulting pharmacists and doctors to review new medication keeps us safe. Do you know that a mix of aspirin, supplements of ginger or garlic could lead to fatal internal bleeding? Antibiotics taken with milk rather than water can affect the absorption and effectiveness of the medication. Some deaths can also be self-inflicted. How? Taking medicine recommended for your neighbor or family member, believing you have the same ailment. Even when the drug is original, its storage determines its effectiveness. Some need cool room temperature, others the fridge. Don't self-medicate.
Remember, don't buy your medicines from unauthorized chemists, kiosks, hawkers, buses, or even supermarkets. Don't!
Look out for the RX sign. See your doctor regularly.
Okay, from local government administration and chieftaincy affairs, we want to move on to another important sector of the Nigerian life, and that's the health sector. We're talking about Ogun State, and the talk in town is about Lassa fever. We're not looking at Lassa fever alone, we're also looking at other related illnesses. There is coronavirus coming from China, but we want to look at how Ogun State government measures the state government is putting in place to tackle all of these. Only yesterday, there was this news that broke that Lassa has entered Ogun State. We have the state epidemiologist in the studio this morning, Dr. Akim Yusuf. Dr. Yusuf, good morning.
Good morning.
Good to have you here.
Thank you very much.
Is there Lassa fever in Ogun State?
Yes, thank you very much. Yesterday, the Honorable Commissioner of Dr. Tomi Koka came on air and officially announced that we have Lassa fever confirmed in a case of a pregnant woman. Okay. Who initially presented at a private hospital where she now was referred to FMC, the Federal Medical Center, Abeokuta, where they suspected Lassa. From their index of suspicion, sample was collected, which I facilitated for it to be sent to the appropriate lab, and the result came out within 24 hours to confirm it to be Lassa fever, and that declares Lassa fever.
Just one case?
Just a case.
Just a case?
Confirmed. Yes.
There were rumors that the woman...
Yes, as against rumors that the woman died or that there were two cases, let me clear the air. We had two cases that were highly suspected at the time we were called in at FMC. The first was a male who was a police officer, and the second was the woman, a 29-year-old pregnant woman. So we collected samples for the two of them to be screened. The result came out simultaneously in less than 24 hours, and the woman came out positive for Lassa, and that confirmed the outbreak. The other man who had died before the result actually came out was a case of dengue fever.
Oh, dengue fever.
Dengue fever.
What is dengue fever?
Dengue fever is also related. It's a viral hemorrhagic fever also, but fortunately it's transmitted by a mosquito. So it is when you are bitten by that mosquito, that's when you get infected. Okay. So it doesn't require the human-to-human contact for it to be transmitted like Lassa does. So what we have for dengue is we require that mosquito for it to be bitten. So the mosquito picks infection from an infected human, or a non-infected man being bitten by an infected mosquito. That's how you get it. So that is still a mystery we need to unravel, that where could he have been bitten, where this could have come from. But for the case, that's another thing. For the case of the woman, she had Lassa. She was actually symptomatic. She had already had a material that's passing blood in urine. That's when they suspected the case in FMC, the Federal Medical Center, and we actually screened.
So the suspicion has to be there first and foremost, because there is this feeling in town that anytime there is you see anybody that has the symptoms, then you could quickly conclude and say, oh, it's Lassa fever.
No.
You have to investigate.
Lassa doesn't jump on someone. It's not a mystery that you just pick in the air without an infection somewhere. The first means of contacting the infection is through the rodent, the Mastomys natalensis, that's the rat that carries the virus. And fortunately in Ogun State, we've not, by evidence, have that rat in our environment. But it's evident we have it in states like the Ondo, Edo, where most times the outbreak comes out first and they have the highest burden of the disease in the country. So most time it is following the human-to-human transmission that our people probably would have gotten it. Oh, okay. So it could be as a sort of traveling to the area of outbreak, like the state I've mentioned, or somebody coming from there. Person probably leaving that state might not be symptomatic, might be feeling fine, but on getting to a point of destination, like maybe she's coming to for an occasion in Ogun State, coming to pay a visit to the family, she might become sick. And you know the usual habits, the family will give first aid, try to give attention. In the process of attending to her, they might get exposed and infected. That's another way true man can be infected. Now, that means is, you know, movement of food items, like the dry food, like gari, dry fish, that probably had been exposed in open environment where these rats have access to come in to feed upon. Once they feed on these items, their saliva, their urine, their feces, they drop on these items, contains the virus as well, though those foods are already contaminated. So when they are being consumed directly without applying it on such food, the person gets exposed and infected also. So it could be that the food items have been transported from the infected community down to our own and unknown to her, because currently we are still asking questions. Like before, at the last minute when she was being transported, I was talking to her. Madam, be calm, be confident, you will be fine. But my interest is that by the time you sleep and wake or you think deep and you could point out where possibly you could have been infected, you could have gotten the contact, please let me know immediately. Because it's really not clear to us where she said she had not traveled, no contact with rats, no history. So the history of where she got it is still not clear. Yes. So I've spoken to her, but she is the only one that can give wisdom. Because most times when they come down with disease, they are not really clear of where they've been infected. But by the time they think deep, they realize, oh, I visited somebody that was sick, or maybe while I was traveling, I met somebody that was sick, or I collected the food item, yes, I saw evidence of it being beaten by a rat, or I ate gari that I don't know where it came from. So it's when you think they're outside, you understand, the time maybe you get down, be able to pick out.
Now, two issues, Dominic, before you come in. Where is the woman now?
Yes. Unlike what they've been saying around that she's dead, no, she is
not dead.
Very, very fine. The commissioner said it yesterday. And I'll mention to us now, I'll congratulate the woman, her family, and people of Ogun State. She had put to bed. She delivered, she was delivered of a baby yesterday. Baby fine, mother fine.
Mother, okay.
Yes.
Okay.
She had a cesarean session. Because we took her, we looked at the circumstances around her. She was 33 plus gestational week old when she was with us. Now she's 34. So at that point, because the virus, the prognosis with pregnancy is bad. It was because it multiplies through the placenta. The multiplication of the virus in the placenta is higher, unlike a normal person that doesn't have is not pregnant. So with pregnancy, it becomes worse. So at that week, the prognosis could be worse if it doesn't get that specialty. We need the specialist attention, the ONG, woman, Lassa cases, not just having a doctor that, okay, the case management that consists of doctors that treat Lassa. But this is a pregnant woman. We also need the specialty of ONG and could require cesarean session or other. So we felt our best chances for this woman was to keep her and the baby is to move her to the Lassa Specialist Center.
Where? In
Irua, Edo State.
Edo State.
That is national. That's what they do there. They have all specialty in terms of managing Lassa. All the equipment there is purposely for Lassa management.
Is that the only one? Is that the only one in Nigeria?
No. We are having them springing up now. We are having Owo, Ondo State.
Okay.
We have in Ekiti. So all states actually are expected to have isolation center for management. Okay. But for like teaching hospital, let me put it that way, a teaching hospital for Lassa is such as we have in Irua.
Oh, okay.
You get that now. So people even go there for training and things like that. It's a specialist center. So we felt our best chances is for her to move there. If it were not to be for her to have been pregnant, we'll have rather taken her to our own isolation center and get her money, because we have trained case management team in whole UTH ready to manage too. Okay. But we look at the circumstances, 33 weeks, the viability of the baby and things like that. So we felt, okay, our chances is better. We want to keep the baby. Otherwise, if we are to have a chance of who should we save first, is the mother. You might let the baby go. But at that age, the baby is viable. 33, the baby can survive. So why not let have the baby and the mother? And that's what the priority we give. And we're happy today. We have the mother. We have the
baby and mother are fine.
Very fine.
Very fine now.
Very
Dominic.
fine.
Now, can we also look at the symptoms of this Lassa fever?
Yes. Thank you very much. Yes, I'm happy you're asking this because we need to push this out to the public. At this point in time, the index of suspicion is more or less like if you have fever, unresponsive fever, you have fever, you're at home, you yourself try to use first aid, analgesic, you felt it is malaria, you consumed your anti-malaria, which actually is not appropriate. What we recommend at this point in time, you have malaria symptoms, please present for screening. Let them screen you for malaria. Because the earlier you are detected, the better your prognosis. I mean, your chance of getting better or survival, because it has medication. Unlike other viral hemolytic fever that doesn't have medication, this has medication. But your prognosis, your chance of getting better is the earlier you commence your treatment. Otherwise, you might suffer the complications of late treatment or the eventuality of death, which we don't want, because that's a case mortality. Now, fever is usually a common and high symptom. In 90% of the cases that we've had have fever. So it's a common symptom. And such fever is such that it's unresponsive. You know, having temperature of as high as 38 degrees Celsius, and you've tried your medication, you've ruled out malaria, you've ruled out sepsis, infection, and still the malaria is not, the fever is not responding, then the doctors, our health workers should start thinking out of the box. Lassa fever, especially now that we have the outbreak. Now, other symptoms include general body weakness, like she presented with general body weakness. That was the first symptom actually presented before fever now coming, because she was pregnant. The weakness will be faster, being a pregnant woman. So the weakness came out as the first symptoms, which she presented first with at the private hospital. Before they now saw hematuria, that's blood in the urine, and wow, at this point we need to refer you, and they referred, which was a good thing to do. When you have a case at hand, I'm talking about our primary facilities at the PHCs and other private facilities that handle cases. When you have a case at hand, now if you suspect Lassa, we don't want you to refer Lassa. They should note that. We don't want you to refer Lassa. There is hotline, that's the viral hemolytic fever hotlines, which you need to call for us to come and attend. You need to have an assessment.
You are talking to private facilities now. Can you call out the number, please?
My phone.
Okay.
I have to check the phone and give out the number. Please, I'll do that. Now, so they need to be conscious. If you suspect Lassa, because we have the outbreak now in town, if you suspect a patient with Lassa, don't refer to FMC, don't refer to OUTH. The appropriate thing to you is to hold the patient where the patient is. We call such holding area. Okay. Don't allow the patient to mingle with other patients. So that patient's area will just be what? Avoided, a little bit quarantined away from other patients. Why you call the viral hemolytic fever hotline, and we will respond. That's the rapid response team will come, we assess. And if this meets the criteria for Lassa, sample will be collected. And we recommend that management should continue, because results will be gotten in less than 24 hours. Maybe we get the result, if it is positive, at that point, patient leaves that center to the isolation center for proper case management. While we also decontaminate that facility, so that that place can be of continuous use for other people that want to attend. Sorry, before you go, before you asked about the symptoms, I've just spoken on Lassa, I've just spoken on fever. No, the other symptoms include the general body weakness. We also have, as it progresses, diarrhea sets in, vomiting sets in, you now have bone pains. Now, what most people see is usually what happens much later, which is bleeding from any of the orifices. So it comes in much later. Many of the symptoms that look like malaria and general body weakness or infection is what comes. The fever, body weakness, vomiting, sore throat, stooling. So before you start thinking of Lassa, you must start treating 1 week malaria, 1 week infection, and it's getting delayed to come in. So whether you start medication for malaria, you screen for malaria, it is positive, treat, and it's not responding, or it is even negative. You screen for infection, it's not you are not having any picture of any bacterial infection in this patient, and you still having fever, then think of Lassa. Let this patient be called upon us immediately so we can give attention and the patient gets treatment as soon as possible. So these are the symptoms. And not just you wait for bleeding. Don't say, Kusha is not bleeding, so no, don't wait till the patient start bleeding. At that point in time, it means it's getting late.
We are going to have you call them, your numbers, but before you do that, what is the incubation period? From when does one, contract the virus and then it begins to fall down? I mean, all of these symptoms that you talked about, and then for what's the period really between when they contract the virus and then all of these symptoms begin to present themselves?
All right, thank you very much. Now, the incubation period, like I asked, is between 5 to 21 days, meaning your period of contact, exposure to the infection, which I will describe, means which you can pick, is after that point of contact, within 5 days, you might manifest the symptoms, such as fever, weakness, sore throat, body pains, diarrhea, vomiting, within 5 days to 21 days. Some people present very early based on your body immunity, and some people present very late. So up to 21 days. After 21 days from the contact, if you are not manifest symptoms, you are off the radar. And that's what we do for those with contact. When we do contact tracing, like she is now, she's a case, she has been confirmed. All those that has had contact with her, from those that have been managing her, the doctors, the nurses, other co-health workers, from the private, the FMC, family members at home, church she went, they have to be on monitoring, which we call the contact tracing, for 21 days. The 21 days will start from their day of last contact. The day you saw or you had anything to do with her last. You monitor it for 21 days. That is the incubation period. That is, we expect you, if you have been infected, to manifest the symptoms within 21 days. That's why you have to put you on the wash for 21 days. After 21 days, if you don't manifest the symptoms, we leave you. It means you've not been infected from our exposure. You get it? So that's what by the incubation period, and that's what we use for the contact tracing. So once you don't manifest symptoms after having contact or a risk or an exposure to things that can bring the disease to you, it means you've not been infected at that point in time.
Okay. Okay. Let's take this break, this short break. When we return, we'll still be having Dr. Hakeem Yusuf. He's the Ogun State epidemiologist, and we're here. We're looking at measures Ogun State government is taking against the spread of Lassa fever. We thank God that the woman that was affected with the illness, the pregnant woman, is fine now. She's fine, and she's been delivered of her baby. That's the good news that we brought to you this morning. We'll take this break. We'll be right back shortly. Stay with us.
Do you know that immunization can protect children from infectious diseases and deformation? Protect your children from childhood killer diseases like measles, polio, smallpox, whooping cough, mumps, and so on. The children of today are leaders of tomorrow. To have a healthy nation, immunize your child today.
Welcome back. Dr. Yusuf, I got curious about something before we actually went on break. You said the rat is not in Ogun State. The rat that causes Lassa fever.
All right.
People have this belief that it is the domestic rat that we see every day, you know, in our neighborhoods, in our rooms, in the kitchen, and all of that. Is it?
No, it's a different species of the rat.
Okay.
This one is we call it Mastomys natalensis. That's the scientific name. But what we need to watch out for, we don't expect people to allow rats. That's the first message. Rats generally at this point in time should be avoided from our environment where we live, where they can have access to our food. That's why the message is that your garbages, your waste should be covered. Should not be a place that will call in rodents. Because when they can access to food, they will come, and from there they will come into the home and stay. That's number one. And also those burning bushes, you are destroying their own habitat, and they need to get another habitat, which is to move down to where we reside. And at this point in time, we don't know which rat is moving in. Is it the domestic rat, which we call the Ratus ratus, or the Lassa rat? The Lassa rat has a feature, and the feature is that that's what we call the Mastomys natalensis. It has multiple mammary glands. It has a lot of mammary glands. If it is killed and it is turned over to look, unlike the normal rat that has between 6, 8, this one could have from 12 to 30 on the other side of the body. So you could see it more, and it's evident that it gives birth to a lot of what do you call the children of rats? The babies. So it means it could multiply also as well. So it has multiple mammary glands. It's a multi-mammary rat animal. Multi-mammate. So that's one feature. But we don't want, because we don't have to now go and keep which rat is here. Is it there? Because by the time you are doing that, you'll have been exposed, touching to find out which rat it is. So the message is avoid rodents around for now. Not even to now, you should make it a standard. Don't put your waste, your garbages where rats will come and feed, and from there will have access to your house, or spread your food where rats, even the domestic rat, because nowadays, with disease we are battling with is zoonotics. Disease coming from animal to human. So we don't know what the domestic rat is even carrying. If you say it is domestic rat and it perches on your food, urinates on your food, defecate on your food, you don't know the disease which might be discovered tomorrow that we might be suffering from. That exposure alone. So the message is avoid it.
Coronavirus there's also the fear, you know, which has gone very rampant in China. Yes, Nigeria is also trying to avoid it coming into the country. Yes. Is Ogun State also ready for that?
Yes, let me say we are ready. It starts from sensitization, which we start creating. It's in Asia. It's a global world. People travel far and wide. Within the next 1 hour, you can have somebody traveling from China down to Nigeria. Yeah. But the first point of call is the airport. There's no road access between us and China or the Asian country. So that's why Lagos and other those have international airports should be highly prepared because they come in the next few minutes. But the person could land in Lagos quite well and take cab or a taxi down to Ogun State. So it doesn't leave us out. So we are as well preparing for it. But the first thing is to send the message out. People need to be aware. Because this disease, the first thing is to know the symptoms. When you know the symptoms, you see somebody having it, you prevent yourself. You also recommend for such to present to the health center early where it can be detected. Because if you don't present, that's when disease and transmission goes undetected. So the first thing, we need everybody to be conscious. The symptoms of coronavirus is that of respiratory, catarrh, sneezing, drooling of saliva, before it now become feverish and things like that. So most times what we recommend at this point in time for people is when you cough, don't even cough into your palms again. It's not recommended. Because at the end of the day, you might not find water or disinfectant to disinfect that hand. And if you are infected, you shake hands with colleagues, you are in the business environment, you shake hands, you greet people, you are transmitting infection. Recommend is done into the elbow. Then you cough to your elbow, it stays there. Nobody hugs you there, nobody shakes you there. It's in your cloth. By the time it dies off. But if you do it in your hand, it's recommended you wash before you now exchange that hand with people. Then when you have your hand, wash hand frequently. Hand washing exercise saves us from more than 50% of infection. Both infected and people that could be exposed from contact with the infected person. So you as an infected person, if you wash your hand, you won't transmit infection through your hand to other people.
So how often should we wash our hands?
Always. If you touch surfaces, you know you're not sure of the surface you've touched, wash your hand. Before eating, wash your hand. Before eating, you wash your hand. Coming out of the toilet, you wash your hand. It should be a practice. You should at any point in time not be too convenient that my hand is clean. You might be looking at your hand like it's clean, but my brother, if you look at it at the microscope, you see millions of microorganisms.
Now, as part of efforts to really reduce Lassa in the country, I heard somebody saying that people should be discouraged from drinking Gary.
Drinking Gary and eating suya. I mean, that has gone viral too.
You can't take Gary from Nigerians. Particularly,
but can you take suya because
Gary and things like that?
Can't take suya away the regular, the popular meat. You know,
can't take it
no, because there is this fear that you know the way suya is wrapped in newspapers, or with newspapers that could have been contaminated,
stored where that could have access.
You know. That has gone viral.
Yes, and that's another issue we need to address. You might discourage people from using old papers that could be carrying their urine of rats where they have stored it or something like that. There is this foil we could use, the silver foil. That's safer because it's always in a container, it's always kept and it's not exposed. Once you open it, unfold it before you can make it usable. But on the issue of suya, one thing about suya is this. If it's meat from the rat, you know, suya commonly is from the cow meat.
Yeah.
The Lassa is not coming from the cow meat. What I want to address here is that even if it is coming from the rat, the first exposed person is the hunter. The next is the person that prepared the meat, who has had contact with the skin, the flesh, the blood of that rodent. Now, after preparation, if it has been heated, like the suya has been, it is being applied to make it consumable. At that point in time, you've destroyed the virus.
Oh, okay.
Yes. So the person consuming at that point in time is safe.
Okay.
Now, where you can get infected is now that paper you now mentioned. If it's an infected paper, you're now putting the warm suya on it. After some time, it gets cool, and the virus can come back on the meat. So you can see the difference. Most importantly, the hunters, those that prepare it. But some of us don't even buy the prepared one. We buy the dead rats that have been hunted, and we go and prepare at home. You might get exposed from the contact. That's why I have to go back to that means of transmission. Like I said, the first transmission is from the rodent, that's the rat. It's after an infected and somebody has been infected from the rat, either by hunting, by preparing, or exposed to the feces, the saliva, the urine of that rat from the food item like gari, fish, bread, meat that the rat has bitten or walked upon. You can get infected. Now, an infected person is now the one that will now transmit to hundreds of other people. Because from home to community where he works, to hospital where he's been attended to, if the index of
workplace,
etc.
Finally, we'd like you to reel out the numbers now. The numbers to call.
The viral hemorrhagic fever hotlines for Ogun State, for anywhere in the state where you suspect a case, you need to call immediately for us to response team to come out, is 081 88 97 83 93.
Once more.
There are two. So this is first one. Are you with me?
Yeah.
081 88 97 83 93. And the other one is 081 88 97 83 92. They are Syria 93 92.
Can you repeat the second?
081 88 97 83 92.
Okay. All right, those are the numbers you could call. If you suspect anything close to Lassa fever, just call. Don't self-medicate. Just call these numbers, and you'll be responded to. Thank you so much, Dr. Akeem Yusuf, Ogun State epidemiologist. We thank you so much for your time on this program, and we'll hope to call you back when necessary. When necessary. Thank you so much. Dominic, we have to go.
Yes, we have to go. We thank you so much for being there since 6:30 when we opened the studio up to this moment. The program is Newdawn, and this is where we are going to be touching down. It's going to come your way again on Wednesday, but Tuonjo will be coming your way tomorrow. I am Dominic Agbeha. On behalf of my colleague Biodo Alabi, we are saying have a wonderful day.